When you look at the number of cases in the U.S. and the number of people in hospital, what needs to be done today for that to go down dramatically?
I think the most important thing we can do today is continue to encourage the public to physically distance and to wear masks. A lot of the research that's coming out is showing that that is working, and so we have to be vigilant. I think we all want to move towards reopening, but looking at the growing case counts, looking at the cases that are burning across the United States, I think it's absolutely critical to maintain those basic public health interventions.
Lauren, it is July 1st. Get out the calendar. Back to school shopping begins in 42 days. Are we going to go back to school? What does the pandemic do to the classroom of elementary schools, middle schools, and those disease-ridden seniors and juniors in high school?
Everybody wants kids to go back to school, probably parents the most. But I think, we have to take a cautious approach to opening. We have a lot more research to do on how kids are affected and how kids transmit the virus. And so there's a few things that are really important in the planning, understanding how you can keep kids safe in the classroom, how you can get them back safely, and also how you can keep the families of the kids and the teachers families safe. I mean, these are adults who some of them may be, and so you have to figure out ways that you can keep them as safe as possible. And that may mean increased testing of kids who are going back to school, better access to testing more broadly for their families, for teachers, for administrators in the school, everyone involved in the process.
What do you think will be the process when somebody in chemistry class in the 10th grade gets the virus or their father gets the virus? How are we going to do that?
Yeah, it's going to be really hard. I mean, I think access to testing remains so critical to all of these reopening strategies. And, schools aren't immune to that just because it seems like kids get less sick or transmit less. There's still a risk. And so if you have someone back at a school who starts to be symptomatic or who has a symptomatic family member, then you backtrack, right? So you do the things that we know work. You identify that kid, isolate them from school or pull them out of school, do contact tracing and symptom monitoring on the people who came into contact with that person. It's hard work, and it's the only option we have right now, those basic public health interventions.
Lauren Sauer, how do we encourage people or even maybe force people to wear masks?
Wearing a mask is politically quite divisive right now, and it's really challenging, and it's something we've been doing a lot of work on. It is a basic intervention. It is safe. We're seeing data that it works. In the early times of the outbreak, there was a lot of mixed messaging because we didn't have enough masks for healthcare workers. We didn't know if people could use them safely. We hadn't educated the public on how to wear them. And a lot of people, myself included, were skeptical on their utility. And I think we've seen a lot of data come out to know that they are effective, not just in keeping ourselves safe, but in keeping other people safe. So the message is really that my mask is for you and your mask is for me. And if we all wear masks, we can get through this a lot more safely with a lot fewer infections and fewer deaths.